News related to COVID-19 and to vaccinations, both for kids 5 to 11 and for those eligible for boosters. I'm joined right now by Dr. Bill Hartman from UW Health to kind of help us sort this new information out. Doctor, thank you so much for joining us here. So the booster shot, right? That third shot situation. What's the latest on that?
So there is some confusion around who gets the boosters, but we'll try to iron it out. Right now, it's just for people who previously had the Pfizer vaccine and had it greater than 6 months ago. These people have to be 65 and older. That's the most vulnerable group and the strongest data that is there to support them getting the booster at this time. Then there's another group that's 18 and older with comorbid conditions, things like diabetes, certain heart conditions, cancer. Those people are all eligible to get the booster. And finally, there's a provision in there for people who are frontline healthcare workers, teachers, people who are faced with the chance of running into the virus at a higher rate than people in other occupations.
Got it. And just out of curiosity, let's say someone had the Moderna shot or the Johnson & Johnson. You're not necessarily recommending them get the Pfizer, the different brand.
Correct. And the way that things are written right now, only people who had the Pfizer shot should get the Pfizer one again. There's the differences in the dosing, and the Moderna data will be evaluated very soon, but their booster dose is likely to be 50% of what the original one was. And so the different dosing regimens probably would indicate that you should just stick with the vaccine that you had previously.
Okay, good. I'm glad that you're able to point that out for us. So as we know, as we've talked about earlier in the show today, Pfizer submitted vaccination data this morning for kids 5 to 11. But what exactly is the FDA here looking for?
Well, they're looking for two things: the safety profile and the effectiveness of the vaccine overall in this children's group. And so the most important thing, we're assuming based on the antibody levels that were generated with the vaccine, that this was a very effective vaccine, similar as it's been in the teenagers and the adults. But the safety profile is very important. We want to make sure that any shot that goes into our children is absolutely the safest vaccine that can occur. And we want to make sure that things like myocarditis, some of the other side effects that are dangerous, didn't show up, and that we can be confident when that shot goes into your child's arm, it's absolutely the safest thing for them.
Well, Dr. Hartman, I would love your clarification on this. As we know, there's sort of a two-factor approval when it comes to boosters, when it comes to vaccines as well. So the CDC approves it first and then the FDA. What's the difference and why do we need both?
Well, it actually goes the other way. The FDA will approve it first and then the CDC, and then it gets signed off by the director of the CDC. They have independent councils looking at the same data and discussing recommendations made by the FDA or by the CDC to their own director. The more people looking at the data, the better the overall interpretation of that data is, so that we know, again, this is the most effective and the safest vaccines out there anywhere for people to get in their arms. We believe, and based on everything that we've seen and the billions of people that have been vaccinated worldwide, these are very safe, these are very effective. They're your best way to prevent getting sick, severely ill, or dying from COVID-19 is to get one of these vaccines in your arm.
Dr. Hartman, thank you so much for joining us. Thank you so much for clarifying all this information. I know for our viewers, it seems like it's always a lot of information, but the more we know, like you said, the better it is for us. Thank you.